I guess this can go with the price we pay videos. I haven't done anything specific besides not getting enough hours of sleep last night. I'm dealing with flare and autonomic dysfunction symptoms today. It comes on really suddenly. My stomach's upset. My joints hurt. I'm stiff. Sometimes it involves fatigue. That's not too bad today, but it's just pain. It just hurts. I'm lying down right now, so it's not too bad. But every time I get up, just taking a step, my ankles hurt, my knees hurt, my hips hurt. Just the pressure of an ordinary step. October is Dysautonomia Awareness month, so I might as well put something up about this. I'm struggling for words because I don't feel well. Your autonomic functions are the things that you don't have to think about. Your heart rate, breathing, your blood pressure, peristalsis for digestion, your body temperature regulation, those things that are supposed to do what they do without you thinking about it at all. If you think about it, those are all really essential things to living. So when you have a dysfunction in your autonomic system in general, when you have dysautonomia, all of that dysregulates. So your heart rate can go weird. I get palpitations. When I stand up, I have orthostatic hypotension, so when I stand up, my blood pressure, if I've been sitting for a little while, it drops about 20 points. That's been documented. I only have pre-syncope, thankfully, so I don't have full syncopal episodes with that. I don't pass out, but it's difficult because I have primary hypertension to treat. So they can't put my blood pressure meds really high enough to put my blood pressure at an ideal level, because if they do, then when I stand up I could pass out. So my cardiologist kept me at a low dose. He didn't want to add medications. I mean, you can't give someone a medication to elevate their blood pressure if you've got them on one to drop their blood pressure. You see how complicated autoimmune conditions and the things that come with it can be. So there's not a lot I can do about that. I have to, when I stand up, I have to be careful. So that's kind of a daily thing. But then when I have a flare like this, it can be really painful. I can go from feeling okay and having energy and running errands and doing whatever, and then just all of a sudden, I hurt. I'm in a cold sweat. I gotta stop. It's really disturbing. You go from fine to just crashing, just really not well. How you feel can turn on a dime. I mean, it can happen so fast. And that could be, a few minutes of heart flutter or something, or it could, I've been feeling like this for a couple of hours now. So, I mean, my evening is just going to be resting at this point. This is just too much. And I think I said that, but I didn't get enough sleep last night. So I have to be careful that I don't push myself too hard when it comes to that. I can push myself with exercise, physical activity, but I have to get adequate rest. People with autoimmune conditions like lupus tend to be overachievers, even if they aren't presently because of their illness, they were before. That's the personality. We are the people who do know how to push. We tend to do that. We overdo it. That's no secret. Perfectly aware. So all this year, part of what I've been learning is not just knowing when to push and do more, but I'm also learning when to say, no, I have to stop. And sleep's a big part of that. It's hard because my mind is going, and I do have the insomnia and all the stupid things that go with it. And a lot of times for people with those issues, you feel like if you go to sleep, you're missing something. I mean, you can't settle your mind down. And I don't take medication for that. I take a supplement called 5-HTP, 5-hydroxytryptophan. It works really well most of the time, and it does incidentally help with the autonomic dysfunction. I was treating it for years not knowing that's what I was doing. I had that conversation with my cardiologist as well, so he seems to feel I have it fairly well managed, as well as can be, without adding another medication with more side effects, which neither of us wanted. So that's where I'm at. That's what I do about it. I eat right. I try to remember to get enough rest. I take 5-HTP every night so I can sleep, and it controls anxiety and whatever else goes with it. And that's the other thing. Anxiety attacks are kind of a part of dysautonomia. A lot of people have that, so it could be part of what triggers it for me. So October, Dysautonomia Awareness Month. I guess I'll put some posts up about that in a day or so. September's almost over.